Welcome to the seventh in the CLE webinar series. Today, actually this month, is Autism Awareness Month, and we'll be talking with Joni Jones and Larry Jones on autism and divorce mediation. Joni's a registered nurse, board certified in psychiatric and mental health nursing. She's one of the original founders and former vice president of Parents of Autistic Children. She's the co-author of 10 Basic Principles of Cultural Competency, a starting point for new mediators. Larry is a retired New Jersey Superior Court judge. During his years on the bench, he authored over 60 opinions on novel issues of law, including one on autism. He's on NJAPM's board of directors and is a professor at Monmouth University and Montclair University. He presently practices mediation, arbitration, and dispute resolution. After the discussion, they will be taking questions, so you can enter your question in the Q&A function or raise your hand during the question period. So welcome, Larry and Joni. Larry, let's start with you, and would you describe what autism is?
Sure. Well, first of all, I want to thank everybody for attending and for particularly during Autism Awareness Month, which they're now calling Autism Acceptance Month. And regardless of the title of the month, it's very important to focus on these issues, particularly if you're a family court mediator. Autism is a neurodevelopmental disorder of the brain. It's a spectrum disorder, means that there are different levels. You could have what's been previously known as high functioning autism or lower functioning autism. They don't really use those designations anymore, but it really demonstrates the fact that no two persons with autism present exactly the same way. And the nature and level and the severity of the disability can vary from person to person, but it affects behavior. It can affect communication. It can affect socialization. It can affect speech. It can affect gross and fine motor skills. And ultimately, it can affect a child's independence or ability to be independent once they become an adult. So these are challenges even for parents who are in an intact family. So when you put a divorce on top of it or a separation, there are even more challenges, and obviously more challenges for a mediator. It's also important to note, Carl, there's no known cause, although there are theories, and no known cure, although there are theories. What is important, though, and Joni will talk about it, is there are ways to increase adaptability of a child ultimately towards independence. And that's what parents really, you would think, would want to do in almost every case, notwithstanding the fact that they may be getting divorced.
Okay. So the high functioning children with autism, are they likely to be independent?
They certainly can be, especially with a lot of the advancements in interventions which have taken place over the last 20 years as a result of autism awareness. Some of you may have heard of the term Asperger's. Again, they don't really use that term anymore. It's really everything is now autism spectrum disorder. But when you hear someone has Asperger Syndrome, it's a prior designation, prior name they use for what really amounts to, in a general sense, high or higher functioning autism spectrum disorder, meaning the person can be independent. They can be actually academically very highly achieving. They can have splinter skills in certain areas, in particular areas, and for example, very good in math, they're very good in science. There are theories that Albert Einstein, for example, or Thomas Jefferson had Asperger's. They were never formally diagnosed, but a lot of people theorize retroactively that was the case. So children with Asperger syndrome or high functioning autism spectrum disorder can, with the appropriate supports, the appropriate diagnosis, the appropriate intervention, can definitely achieve a level of independence and a level of success, not just independence, but success, and can even be leaders in whatever field they go into, provided the supports are there to increase the chances of success. There are lots of children who perhaps have Asperger's or high functioning autism, but because it's not diagnosed, because the interventions do not take place, because the therapies do not take place, their potential is then artificially capped or can be artificially capped. So this is very important in a divorce scenario or separation scenario, not to let that happen as a result of parents disagreeing with each other on everything.
Okay. And at the other end of the spectrum, the most disabled, are they unlikely to ever be independent?
Well, again, you never want to say anything is guaranteed, but if you take a child with severe autism, I mean severe, but they don't speak, they can't function, they really can't do anything for themselves. There can be challenges in obtaining full independence. Now, even in those cases, though, it's worth the investment in time and energy and resources to have the intervention so that there is a level of improvement, sometimes substantial improvement. So as an adult, even if they're not fully independent, they could be partially independent. They can function in a group home setting and work in certain environments and things like that. So you never want to just assume because a child has a diagnosis of autism or even severe autism, at a low level, level 3 autism, at an early stage, that their future is now capped or finished. You should assume the opposite, that you go for as much intervention and as much increase of potential as you possibly can, and then wherever fate has it, you can do as much as you can, obviously, but you always want to think constructively and positively.
So, Joni, let's turn to you. Is it important for a mediator to know where a child is on the autism spectrum and what the present level of functioning of the child is?
Yeah, it becomes very important because sometimes between the two caregivers, there's not even a consensus that there is a diagnosis. And the importance of a diagnosis is that there can be the support services available, and also that a plan of care can be developed. Sometimes there's what's called an underdiagnosis. So many times we see an individual that has attention deficit hyperactivity disorder, and really down the road, it comes out that there is a diagnosis of level 1 ASD, autism spectrum disorder, formerly known as Asperger Syndrome. We also see by the age of 4 that there are sometimes going into the area of oppositional defiance disorder. And then also we might see speech delays. So there can be a whole different underdiagnosis to somebody that's on the spectrum. So it becomes very important because, like Larry said, that intensity and that consistency becomes very important because, when you have a spectrum disorder like Larry tapped into, you can have people with the same diagnosis, but they can have different traits, and they also can have different intensity of those traits. And that's why if you're going to be developing, the plan, it's important to know where the child is. And you've got to be very careful. Larry touched on it a little bit, but somebody that is diagnosed with, let's say, level 1 or the higher functioning Asperger or autism spectrum disorder, you have to be very careful that they don't fall through the cracks. A lot of parents might say, hey, you know what? Started reading when they were 2 years old, or they can tell us the square root of something, and not have any idea of how they got there. It's not unusual for people on the spectrum to think in pictures or to have what's called photographic memories. And that in the school district can become very fooling because you think that they're really higher functioning. When they get into more social demands, if they don't have those foundations set, this is where we see them either lack in their progress or what's known as the regression. So it's very important to know that there is a diagnosis, that it is agreed upon, especially for those services, and it's going to structure what the mediation issues are going to be.
And you may see, Carl, in a lot of mediations, let's say you have one parent who says that the child does not have autism or denies that the child has autism. And they'll say things like, well, look at the report card, it's straight A's, and it's the smartest kid I've ever seen, and it, like Joni says, it can be really deceptive because a 4 or 5 year old with high functioning autism could, for example, maybe read 2 years before everyone else, might even memorize lists of random things like the name of every model car or the name of every battle of the Civil War, or all the presidents or states. And it seems like this is a really super high level of intelligence, and to some degree it is. But that's only a tiny picture of a piece of the puzzle when you're talking about autism. And if that's all the child's focusing on or perseverating on, those skills become less and less practical as time goes on, and less functional. So you could have a child who grows up great, they can memorize lists, but they can't get employment. They can't get a job. They can't socialize. A lot of autism spectrum disorder is a social disorder. It truly is. And the social demands for a 4-year-old are not going to be the same as they are, for example, a teenager. But if you don't get a head start in getting the child to the teen years, by the time he or she becomes a teenager, the challenges may be far greater than would have been the case had the parents been planning ahead.
Is there resistance sometimes among parents to ask schools to test their children for autism?
Yeah, there's still a stigma that's associated with it, even though we've come a long way and have had better outcomes. People just still minimize what the child's overall true diagnosis is, because they have that stigma that it's something negative when it can really end up to be something very positive.
There have been lots of people who will say, and you see this even with intact families sometimes, if you go to an autism convention or a conference, it's very common to see, if you look around, only one parent is there instead of two. Now, obviously, sometimes the other parent has to work, we understand that. But that's not the only reason for that, because you talk to parents and you see more and more and more and hear more and more that one parent, the other parent just has kind of detached from it and they think in some way it's labeling their child. So they'll say things like, and I've seen this even in mediation, someone comes in and says, my child doesn't have autism. He has pervasive developmental disorder or sensory integration dysfunction. And what they're describing are a lot of the symptoms of autism spectrum disorder that at the very least would indicate that the child may at least be in a higher risk category to get an updated diagnosis. And you find out, well, when you say your child doesn't have autism, when was the last time there was a diagnosis? Either never or 6 years earlier or whatever it is. But there's certain clues that at least should lead anybody, you don't have to be a doctor to understand that there are certain clues that if a child manifests certain signs or symptoms, that he or she might be at risk for autism spectrum disorder. Like, for example, limited or no eye contact, limited or no speech, lack of response to initiation of conversation, self-stimulating activities, lining up objects in a row, a need for sameness in routines, a heightened interest in random information, associating more with adults than same age peers, hypersensitive hearing, sensibility to certain fabrics. Some children with autism, they have to turn their clothing inside out because they don't like the feel of the stitching, low muscle tone, gross and fine motor skill challenges. So if a child has just a couple of these things, you have to start as a parent, just look a little more carefully at it. You don't self-diagnose. You obviously have to go to a doctor to get a diagnosis, but at least you're alert to the fact that, well, maybe there is something more here than just, a developmental delay. Because if you get the diagnosis early and the child does have the diagnosis, then there's the opportunity for eligibility for services that are available much earlier, either through the school district or the child's really young through early intervention.
All right. Joni, what's a plan of intervention?
Well, because each child is different, there's no two people that are exactly alike. They usually have to probe out to see what the issues are. You may have somebody who can't sit, attend, and focus. And sometimes we have to go all the way back to those interfering behaviors, because those are the prerequisites to learning. So if you can't sit, attend, and focus, it's going to be very difficult for that child to learn. And we have to look at brain development, because very surprisingly, approximately 90% of the brain is developed before a child goes to kindergarten. And then there's something that's called neuroplasticity of the brain, and that's the ability of the brain to change through learning. Some people may know that as rewiring the brain. The important thing about that, though, is yes, there's plasticity until the day that we die. So we can learn and we can change. But as we age, that rate of change decreases. So it's very important that we get individuals as young as they are, and have that intensity and that consistency in the retraining of the brain to reach optimal potentials. And if we look at the different levels, and you said something about this before, and I personally know individuals that were level 3, they were headbanging, raged, couldn't talk, had to wear a helmet, and they have become college graduates.
Oh.
Nobody has a crystal ball. And it's that intensity and that consistency and getting them when they are very young for them to reach, their particular potentials. So if somebody's not speaking or communicating, to me, that would be a very, very strong area of focus, because it might be something very simple. The voice can only repeat what the ear hears. And like Larry said, if somebody has more challenges with hypersensitive hearing and sound becomes very painful to them because they're having more of a bone conduction than an air conduction, that's when we see them act deaf, or they respond to people's sounds where you can call their name and they act deaf. That if you go through those interventions, you may see that rate of acquisition go up, because you have now connected a very basic foundational issue that is impeding their learning and their potential. And then, Carl, what becomes important in that agreement, in that plan of care, that's going to set the issues for the mediation process. So are we looking at, somebody who's going to wind up in a group home as parents age out, or are they going to go to college and get a job and live on their own and raise a family? Do they need job coaching? Do they need to go to certain programs out in the community if they're not going to college to continue with those skill building towards those level of independence? Or is it something like Larry said, is it a young child that still needs those independent evaluations? And, depending on the age of the child, if it's below the age of 3, they can go through early intervention, not really needing a referral for that. Or if they're above the age of 3, they can go to their school districts. And if one particular caregiver doesn't agree with what the school district has come up in their evaluation, they are entitled to have independent evaluations of their choosing through a list, so that they can get a second opinion, more or less. So we also might want to use people that are already present. If there's a therapist that's involved, they can do an evaluation and find out in that plan of care what issues still need to be addressed. Because as an individual with autism spectrum disorder learns skills, it is not unusual for them to lose skills. So we constantly have to be looking, do they really master the skill? Also, we can look at insurance companies, because insurance companies are now paying for some of these interventions and evaluations. And some people just, if they can afford it, they go for the private pay. So other issues, depending on the age, that comes up in mediation, might be something with guardianship. Or it might be who's going to be present during that, the IEP representation. How is that going to be structured? And that's the individual educational plan that we see developed in the school system.
Okay. Larry, when it comes to parenting plans, are these likely to be very different for autistic child than for a non-disabled child?
They certainly can be. And again, it really depends on the structure of the particular case. If you're mediating a case and 2 people come in, let's say hypothetically, they've had a child who's been diagnosed with autism. They're both on board with the diagnosis as well as the intervention. And they've worked out kind of their own parenting schedule between themselves. The mediator may not need to get really involved with that, because that's not really what they're asking you to do. They're asking you to mediate something else. So every case involving a child with autism doesn't mean you have to get all involved with the autism. It's only when they have disagreements that relate to the autism where the mediators, skills and abilities are going to come into play. And so, for example, if you have a case where, a child has either just been diagnosed or has not yet even been diagnosed, and there's an issue over that, or has just started the therapeutic regimen. What I mean by therapeutic regimen, if you have a child diagnosed with autism, it may involve a lot of intense intervention, particularly at an early age, that may be not only during the school hours, but sometimes home-based therapy and center-based therapy, additional services, behavioral therapists, speech therapists, occupational therapists, all, mental health services. There are all types of different potential ancillary services that may be involved depending on the child's needs. So now you have, even in an intact family, you have to kind of figure out how this is going to work. And sometimes people, they actually, quit their jobs or change their jobs to home-based or go from full-time to part-time, at least one parent in an intact family, to try to get the child to the services, etc. Or to be home when there's home-based services. So now you have a separation or a divorce, and the parent, particularly if there's a parent who's not really as educated as he or she may need to be in autism spectrum disorder, and they take the position, or their attorney takes the position, we're looking for 50-50 time, let's say, hypothetically. Well, that might work out great if that 50-50 schedule can be accommodated without substantially interfering with the necessary therapeutic program the child needs. For example, if the parents live real close together and both parents are on board and they're engaged in the therapy and they're learning from the therapist and they're reinforcing whatever is learned in the therapy. On the other hand, if you have a parent who just says, listen, I want my time, whether it's 50-50 or 60-40 or whatever it may be, and it's pulling the child out of therapy, and worse, the parent who has the child is not doing anything to further facilitate the therapeutic growth of the child during his or her time with the child, it can result in mixed signals. It can result in a lack of consistency and intensity in the child's program. It can result in stagnation in the child's progress, and it can result in regression. So by way of example, these are all can. There's not a guarantee that any of this can happen, but studies show that it certainly can. It's a risk that every parent really needs to be aware of before they start just saying, oh, I want 50-50 time or whatever it is on their calendar for whatever reason. You can't treat, if there's a child who needs therapies, it's a huge mistake to mediate a case as if those therapies don't exist. As if, well, first we're going to figure out the schedule for the parents and then work the therapies into it. You kind of got to look at it from reverse engineering. You have to say, well, what therapies does the child need, and how can we arrange a program where each parent has a right to maximize their time with the child and enjoy their constitutional right to parenting time, but also where it does not unreasonably interfere with the child's other needs, because the child's going to have more needs than fun time with either parent, or sitting and watching TV or playing on a computer in either parent's house. There's really an investment that each parent has to make in not only their financial resources when available, but their time and energies in working together on this. So the parenting schedule, absolutely, if it's going to be logical and reasonable, has to relate to what the child's other schedule is. Now, that doesn't mean if the child has therapies 40 hours a week that the non-custodial parent is not allowed to have any time with the child. But in the course of the mediation, you want to try to get the other parent as involved as possible. And so his or her time with the child involves not only participating in the therapies, but also in the time when the child's not in therapy, where there's progressive reinforcement of the skills, even if it's going to the mall or going to a baseball game or going on vacation, and making part of that, the constant reinforcement of the skills that the child's learning with the actual therapist.
So is consistency between the parents a really important factor when you're looking at parenting plans?
Oh yeah, yes. When you have the parents who are pulling at each other or refuse to see eye to eye on anything, when Joni said before about a child falling through the cracks, there's a real risk of that happening when the parents say they want what's best for the child and they mean it, but their actions reflect something that's almost doomed to be the opposite. When you have two parents struggling with each other in a divorce and they can't even talk to each other, they can't communicate with each other, each one's saying that the other one's trying to tell them what to do, each side's got their own laundry list of grievances against the other parent, they're just not working as they need to, as even if they don't like each other, as coordinated teammates, really, and partners as parents, even after separation and divorce, in working together so that the child's program is as consistent between one household and the other on a long-term basis. Because imagine you're the child in the middle of this situation. We know that children with autism have a much better chance of thriving when there's a consistency to their program. They don't do very well with transition in general. Now, that doesn't mean some parents say, well, my child with autism doesn't transition well, so there should be no parenting time with the other parent. That's not what that means. What it means is there has to be a higher level of hypervigilance in monitoring this and working through a transitional approach and schedule consistent with a therapist, consistent with professionals, to make sure that the child doesn't fall through the cracks and both parents are on board with what needs to be done. That way, a child with autism, with separated or divorced parents, still has a chance of maximizing his or her potential.
Okay, so you mentioned earlier, if the parents are already working well together and they have a parenting plan and it's working, there may not be a lot for the mediator to do with respect to that.
There may not, but Carl, let me just say one point on that, if I can. Mediators shouldn't overstep their bounds, but I can tell you that I've seen some cases where the parents come in and they agree on everything, and it's very obvious to me that what they're agreeing on is because neither parent really has as much information about autism spectrum disorder as they probably need to have. So, for example, they're in agreement, and their child is getting, an hour of therapy a week, when the school district itself could provide a lot more than that. Well, they've reached an agreement, but it may turn out with just a general discussion about the subject matter with them, they may jointly agree to seek more. So, a mediator has to, there's nothing wrong with, if it's appropriate to talk in general about some things, but obviously if they're not asking you to mediate autism related issues, you don't insert yourself into that over their objections.
So now let's turn to the couple where they're not even in agreement,
right,
on whether the child has autism or what should be done. What does a mediator do in that position?
Well, obviously, the first thing if the mediator is going to be of some assistance to the parties, because it may well be in a hypothetical case that the child does not have autism. Maybe don't just assume the child has autism. The child could be at risk for autism. But if there's been no diagnosis yet, I believe the appropriate thing for a mediator to consider recommending is to treat the issue as if it was still an intact family. What would you do if it was an intact family and there were some signs or symptoms of autism, and one parent felt the child might have autism and the other one said the child doesn't have autism? Well, the most obvious thing is you'd get a diagnosis. You'd have an evaluation done. And as Joni said before, the evaluation could be through a private physician, developmental pediatrician, psychologist, whatever. It could be through the school district, which if the child is of a certain age, you are allowed to get evaluations at the school district's expense. And you need to find out. There are evaluations, there are comprehensive evaluations in different centers throughout New Jersey, where insurance may cover it. So you need to first know what you're dealing with. You don't self-diagnose. So, for example, when I was on the bench and I'd have this situation, and one parent would say there's autism, and the other parent would say there's not autism, he or she's exaggerating. I'd say, okay, well, for me to make a decision, the first thing I got to know is from somebody who's trained in this area, not just the parent. So I'd order them actually to do an evaluation. So when I had the evaluation, if the evaluation came back and said autism spectrum disorder, now you know what you're dealing with. For a parent not to even agree to the evaluation can be very problematic. Just like if a child, had symptoms of the flu, you take them for an evaluation to make sure that they don't have the flu, and if they do have the flu, then the treatment starts.
Okay. Joni, sort of generalizing, what's the ongoing role of parents following divorce when there is an autistic child?
Well, like we've heard several times before, it's very important that you would follow what you would do if you remained an intact family. But I want to go back a little bit and use an analogy on the importance of intensity and consistency. And what I describe as, let's say, for instance, you had a child that fell in a well and you were trying to get that child out of the well. You throw a rope down, you pull, then you slack, pull, slack. When do you ever get that child out of the well? It's no different when you're dealing with children on the spectrum, because they are in their world and out of their world, in their world and out of their world. So where mediation is concerned, you might have parents that sit there and say, well, you know what? They're with their therapist or they're with the school district and they're getting services that way. Well, if you look at it, when they're engaging, it's in their world, when they're at home, out of their world, when they're in with the professionals. And if you have in parenting time, somebody who doesn't want to deal with behaviors, because if there's no demands placed on the child, why would they scream and yell and do all those negative behaviors if they're allowed to sit on a computer for 4 hours at a time? So that's why the intensity and the consistency becomes very important. Secondly, they don't learn incidentally like neurotypically developing children do. So they don't naturally generalize or take a skill from one setting to another. So you might see that they know how to do something in one particular setting, but they don't know how to do it in another. That skill is not considered mastered. And somebody might be able to follow directions if you tell them to do something, but left to their own, they don't know how to do something. So I'll give an analogy to that. If I was driving in a car and somebody was telling me, make a left here, make a right here, because I didn't know where I was going, I could follow those directions perfectly. Now put me in the car by myself and I'm supposed to navigate, I will not have a clue, because I wasn't sequencing and attending and focusing. And these are all these skills that they need to learn. And how does learning take place? It takes place through repetition. So let's look back when we were in school and we studied for a test, and we may have gotten 100 on that test, but ask us the same question 2 weeks later, we won't have a clue. Right. Because we memorized it, we didn't learn it. So that is really the importance of the intensity and consistency. And what I usually recommend, and this is to take out, miscommunication, is to have some form of written communication, whether that be, through an email, through texting, through a composition book, so that both caregivers know exactly what's being worked on, what their responses are, what has worked, what hasn't worked, so that there's that, not only that intensity and consistency, but you're decreasing the perceptions of like, no, you said this, no, you said that. It's clearly written and it's precise. And this becomes also important with the consistency. For example, we want to make sure that there's supplies that are there. So the child on the spectrum isn't motivated to learn just by the social reinforcements. So usually they'll pick something that is a reward to them. But you want to use a reward only once for a particular thing if it's a higher demand. And I'll give an example. If you're trying to toilet train and they had a favorite book, you only want to use that particular motivator, that reward for that skill of toilet training. Because if they can get that book at any given time, why should they bother doing something that's more demanding? So you really want to be consistent even in the rewards that are used, either by passing them back and forth or getting duplication. You want to have the supplies, like Larry said, when you get into sensory processing, that can affect a person's ability to sit, attend, and focus. You want to have those supplies available if they're on special diets. A lot of times you see a gluten-free diet or a dye-free. diet. You want to make sure that either that food is being supplied during that visitation, or there's lists that are supplied that those foods can be in that particular house. Like Larry said, you know, sometimes in mediation, you may have a particular caregiver that was the predominant one, and they're really fearful to let go for parenting time. They're hovering. They want to be in control. They go into the what ifs. What if I'm not doing it? What if this happens? So when people go into their new roles, you want to discuss and structure that parenting time for trainings. You know, there's a lot of ways that you can utilize resources that are already there. If they're in the school, you can add to the IEP parental training and get some home therapy, and you can have it in multiple homes. It doesn't have to be one particular house specifically.
Or you can ask for it. The district doesn't necessarily have to provide it, but you can ask for it.
Or you can utilize, if you have an ABA therapist, you can ask them to do some of the trainings. And there's a lot of webinars that are training. So, you know, it's important also for the person who's sort of not letting go to change to the positive things about that. And one of the biggest things is what's called generalization, because a child hasn't mastered a skill unless they can do it across all settings. So when they're in another home around different people, using a little bit of variations of things to learn, there is your generalization. So if you say, hey, let's look at it in a way where the child's going to have more opportunities to master a skill sooner through that generalization, this can actually be, you know, a very good thing. Mediators might come into some problems, though, with the person who now has been, you know, coordinating everything and has to like kind of let go what to do with their own downtime. So that has to be structured and looked at in a very particular way, because they can have very, very perseverative thoughts, especially when I talked about what ifs.
Yeah, it's also very helpful in a more general sense with mediators who are dealing with these types of issues. And you have a parent who maybe is concerned, and perhaps justifiably so, of quote letting go, like Joni says, and the other parent wanting the opportunity, even if he or she was not the primary caretaker when the time the parties were together, to become that, or to at least become more of a co-parent, because they're in different roles now. They're separated or divorced, and their prior dynamic was not going to be locked in forever, you know, as a result of a separation or a divorce. And so, you know, sometimes if the parties are willing to consider it, it's worth looking at the possibility of structuring a plan on a trial basis, without prejudice, on a de novo basis. Say, well, let's try this for a month, short term, you know, let's try this for 2 months, and then we'll see how it goes. The therapist can report back, or the child study team can report back if there's progress, or if there's regression. If there's regression, you don't even have to wait a month to come back. There could be it could be a Zoom call, and we could, you know, put things on hold. And if things are really backfiring, that type of thing, you don't want to take unnecessary risks. But that doesn't mean you can't take any potential risk at all because of all the what ifs. You know, you have to weigh the risks versus the benefits. So there are many times I've had mediations, for example, where I say, look, you know, because the one who was the primary caretaker is concerned about, you know, loosening the reins at all. The one who is, let's say, the non-custodial parent, has in his or her head that the other parent is just trying to control them. Like, we have to try to see what can work here, without getting, without chasing our own shadows. Say, well, let's try this on a slightly modified transitional basis for, say, hypothetically 30 days. With the advanced consent of the therapist. So you don't just do it. You say, is this okay? And then you schedule a follow-up for 30 days later. It doesn't set a new status quo. It doesn't say that it's not cast in stone. So everyone can kind of see how it worked out. And sometimes, because it worked out not so badly, that in 30 days time, there's room to now, everyone's a little calmer. Now, okay, maybe we can just stick with this, or perhaps make more modifications. The other thing is, and really as a result in large part of COVID, and the popularity of Zoom, it creates opportunities. Look for silver linings in dark clouds, right? The Zoom has created an opportunity for parents who would never even agree to be in the same room with each other to watch, for example, their child's therapy, or to be co-counseled by a autism therapist, to do so through Zoom. So if they don't want to be in the same room or the same house or the same city with each other, they don't have to do that, but you could still do it through Zoom as long as the therapist is willing to speak with both sides together at the same time. The therapy could take place sometimes in mom's house, sometimes in dad's house, with the other parent watching by Zoom. And some parents are actually okay with being together in the same place. So you want to use the tools that are available to try things on a trial basis, as long as it's not taking on unreasonable risk, as long as it's cleared first with the professionals, and you might get some progress that way and overcome the obstacles that Joni was talking about that otherwise might exist because of the impaired dynamic, or sometimes the dysfunctional dynamic between the parents themselves.
Okay, let's turn to some of the other issues that come up in a divorce mediation. So how do you deal with alimony and equitable distribution? How is that going to be different?
Okay.
Or potentially?
Well, it can be. It may or may not be, depending on the circumstances. But let's give a hypothetical where it might be. First of all, alimony, equitable distribution, and of course, child support. So child support, generally, as we know in New Jersey, there are child support guidelines. You can deviate from the guidelines, but if there's a disability or special expenses. But the mere fact that a child has autism doesn't automatically mean you deviate from the guidelines. It means you could deviate from the guidelines if there is a financial basis and logic to do so, which usually means what are the extra expenses, either currently or reasonably anticipated in the near future, that are derived, that stem from the autism. So Joni mentioned, for example, special supplies that a therapist may need. There may be, for example, the child has sensory integration dysfunction. You may have to buy special clothes for them that don't irritate them. They may have to eat special foods because they may not be able to digest certain foods, and they may be more costly, gluten-free and stuff like that. And so the first question is, if you're talking about heightened support for child support, that a mediator may want to ask is for the party who's seeking that to identify with some documentation, with a budget, what are these additional expenses we're talking about? And if they're estimates, that's okay, because not everything can be exactly itemized to the penny, but some corroboration or some basis for the numbers. You don't just say, oh, that's double support because the child has any disability. It has to relate to the financial consequences of that disability. So that's number one. And sometimes if it's itemized, if it's a reasonable budget, just like a CIS, it can justify an increased amount of support. And if it doesn't settle in mediation, I believe that's exactly what any reasonable court's going to be looking for if that application is brought before the court in terms of off guidelines support. What is the financial consequence of the disability, direct or indirect? There could be other expenses too. When you talk about alimony is very different from child support, obviously, even though it may come from the same payer. Alimony is support for the spouse, not for the child. However, if you look at the alimony statute and the criteria for alimony, one of the criteria is custodial responsibilities for the child. So, for example, let's say you have a hypothetical case where a child has autism, needs all of these services, and the primary custodian basically had to leave their job or limit their job to supervise all of these therapies or to get the child from point A to point B. And the other parent just isn't involved voluntarily. Not every parent, it's unfortunate to say, but it's true. Not every parent has a desire to be as involved as perhaps they could be, And so you have a parent who, maybe visits every other weekend, if that, and, is just kind of gone on with their life, or that's what they want. And so, that has put a financial impediment, arguably, on the primary custodian because they can't work to their level. They're responsible for all of these other things in the child's life, which are legitimate and reasonable and arguably necessary in a lot of cases. So might there be a basis for alimony in that type of case, not only because of the custodial responsibilities, but all the other criteria in the, alimony statute? Yeah, it could be, especially if there's a financial impact on the primary custodian. Also, if you have a parent who doesn't come around at all, doesn't exercise parenting time, then the custodial parent, the residential custodian, in this hypothetical, has no opportunity for a break, has no opportunity for what they call respite, has no opportunity to refuel. And, some parents say, I'm with my child 24/7, but, everybody needs a break, no matter how much you love your child. Everybody needs a break, just biologically. That's what you got to refuel. You got to mentally, physically, and every way. That's how you have weekends and vacations, And so if the other parent isn't there to spell the first parent, there may be an additional cost for respite. Then there could be daycare costs. And so these all relate. Alimony and child support kind of relate to each other. So there could be a real basis for alimony in certain cases. Now, if all the expenses are paid for by the school district or insurance, and the child in the school 9 to 4 or whatever, and mom has a full-time job or dad has a full-time job, whoever is the residential custodian, then the autism really doesn't create as obvious a basis for alimony in that scenario as it might be. So you don't just say, well, there's a disability, so there's alimony. You have to look at how it is reasonably impacted on the alimony recipient's ability to earn, is really what you're talking about in their resources. Equitable distribution.
Larry, let me just interrupt for a moment, because numerous people have pointed out to me that I have failed to give the code.
The code, okay.
Attendance codes. I've been so interested in what you've been saying.
Okay.
So the first code is 1776, 1776, and I will give another code. So thank you for everyone who pointed that out.
Speaking of codes, I heard this morning on the news that a bunch of people rushed to get married this weekend because they were going to have the wedding date of 4/3/21, April 3rd, 2021. But in any event, so equitable distribution, that relates obviously to alimony as well as child support. If you look at the alimony statute, one of the things they look at is equitable distribution. And so you have to look at things, for example, like if you're going to sell the house to get access to equity, when you want to do that, because, well, if you're mediating a case where the parties have equity in a house, you may, in a traditional case, say, okay, you're going to sell the house. What if you sell the house and divide it 50-50? All right. Well, if you have a child with autism and is getting, top-notch services in the school district, and that house is sold and someone's leaving the school district, those services are not necessarily going to be replicated in the new school district. So you have to be very careful. You can sell your house, but when you have a discussion concerning mediation about what you're going to do with that, you have to take a look at what the consequences of an immediate sale may be. Also, equitable distribution, you have to take a look at, when you're talking about dividing different assets, if there are private expenses that you may need to supplement the child's resources, private therapists, whatever the case may be, training. That may, for purposes of equitable distribution, there could be obviously a trust fund set up, or a security trust fund to protect the payment of some of those reasonably anticipated expenses. And debts, which is also a big part of equitable distribution. Sometimes a lot of people who have a special needs child, not just with autism, but any special needs child, there are mounting debts from the services on credit cards and otherwise. So these things clearly have to be looked at carefully in a balanced way in mediation.
Okay. Before we go to the remainder of the questions I had, let's go to a couple of questions, okay? One is, are there specific strategies mediators can use when parents do not follow through with behavior management and therapies, either because they don't agree on the diagnosis or otherwise?
Well, I think it really depends on whether you're talking about one parent not following through or both parents not following through. If you have a case, and again, every case stands on its own facts, but in general, if you have a case where neither parent is following through with what they're supposed to be doing, which, by the way, happens in intact families sometimes too, unfortunately. While the mediator can certainly, try to encourage both parents to, to the benefits of following through, there are some limitations, obviously, in what the mediator's role is. They're not going, if they're coming to you for divorce mediation, they're not coming to you as an autism counselor, and you can certainly refer them to an autism professional or whatever the case may be. If you have a situation where one parent is following through and the other parent is clearly not, there are there's different approaches you can take. Obviously, if the game plan is to get both parents to participate, one thing you can do is in caucus, separate them out. So you don't want to embarrass one parent in front of the other parent. Obviously, that rarely, if ever, works. And talk with the parent who's not cooperating about, in a very constructive way, not condemning them or anything like that, but to try to draw out of them what they want for their child, where they want do they want their child to be a success? Do they want their child to progress? And if so, what are they willing to do to get to that particular point? And if they are willing to, participate further, and they have some legitimate reasons why they have not, they may have a whole laundry list of reasons. They had someone was sick and this and that and the other responsibilities, but they have to get on board. And if they're not getting on board, there's going to be a point in time where if there's not a consensus, if one parent says, I'm just not doing this, the mediator's not serving as a judge, the mediator's not serving as an arbitrator. They may find themselves at a stalemate at that point. But hopefully, by using constructive encouragement and setting a next date and say, well, what if we did it this way, that way? So sometimes you get them on board. And very often, the way to do it is when they hear it, as long as they hear it from someone other than their ex-spouse or their ex-partner, sometimes they're much more willing to go along with it. So if you get the therapist involved, the therapist doesn't become an evaluator necessarily, but if will you listen to the therapist? And the therapist says, I advise you to do X, Y, and Z. Are you willing to do it for 30 days and then come back? Yes, I just don't want my ex, browbeating me about it, that kind of thing. Then you might see a little more cooperation. I have seen that dynamic work in other cases.
Yeah, okay. And I'm just going to piggyback onto that a little bit, because if you can get them to define what they believe the challenges are in their child, then you may be able to back into those evaluations by what Larry said, focusing on what their outcomes are and how is the beginning process to get to those outcomes, which again goes back to what I said in the very beginning. The important thing about the diagnosis is to qualify for interventions that are not going to be, astronomical costs to the parents.
Okay, here's another one. Let me throw this one to you, Joni. If there are several children of different ages in the family, would you recommend that parenting time with the autistic child be separate from parenting time with the child or children who are not on the autism spectrum?
Well, this is like a really good question, because mediators can offer, creativity in the parenting time. It doesn't have to be like Larry said, like a 50-50, a split. It's important for the non-affected children to have some of that alone time. If everything's going to be, therapy driven, we want to include the siblings. We want to include everybody in the family. In all those interventions for the intensity and the consistency and the inclusion. But, that non-affective child needs his respite time too. He needs or she needs to go out and have fun times where those demands aren't overflowing there too. So you can get creative where you can have visitation time where, all the children are together, and then maybe the affected individual is alone, or maybe the non-affected is alone, and you can rotate those schedules. And that may be a way of even introducing more parenting time by making such a division of that.
Yeah, and Carl, also, that even applies in typical families without a child with autism. The concept that all the children must go together as a package deal is something which doesn't necessarily have to happen in every case. And quite frankly, sometimes it's not even in the children's best interest for that to occur. I can tell you, when I used to interview children in Cameron, I was on the bench, lots of these children who had, siblings or the blended families, whatever, they wanted to have some one-on-one time with each parent. Their interests with their siblings were not the same. They were different ages. They had just different. One liked sports, the other liked, museums. And now I put a child with autism in there, and if the parent's focus has to be on the therapy, well, as much as a sibling may love the sibling with the disability, they need and want their own time as well. So the concept, again, on a trial basis of saying, well, let's try this out for a month or 2 months, whatever. And it's, we'll do, you take all the kids together the first week. The second week, you just take this child. The second, third week, you take this child, and see how it works. Now the children have their alone time. They have their together time, and you can blend it in that fashion. And there's nothing wrong with trying that out. Now, if you're talking about separating twins, you might not want to do that. But even then, even in those cases, sometimes for certain parenting time, that they're different individuals, even twins. So you don't know.
Okay. Let me read the second code, and then I'm going to go to Rebecca, who has raised her hand. So the second code is 2106, 2106. Okay, Rebecca, I have turned on your talk. So if you unmute yourself and ask your question.
Hi there, how you doing?
Good afternoon, Rebecca.
Great. I had a question about the financial aspects when, like you were saying, talking about alimony and child support, when the parents don't necessarily disagree about the child's diagnosis or needs, but they are in disagreement about how those needs can be met or must be met. So for example, if one parent has the support of a clinician describing the kind of program the child needs, but it's something that with or without reimbursement from school district could be very expensive and therefore impact the entire negotiation. And the other parent may even support that program, that child going to that program, and know it's a good idea, but they don't want to have to pay for it, basically. They think that maybe there's something less expensive, or that maybe they shouldn't have to pay so much in support because now they've got this other extraordinary expense. So in the example that you gave where one parent stayed at home and was the primary caregiver for, say, an autistic child, now that person is in a position of having been out of the workforce for quite some time, still devoting a lot of time to figuring things out for this child, even if they're older. And their settlement negotiation is being driven in a certain direction by the disagreement over how much to spend to serve the child's needs.
Right. There may be legitimate, very legitimate, genuine, good faith disputes between two parents over this, how to best allocate resources for the special needs child. So for example, if one parent says, listen, I want the child to go to this type of therapy, and it's not going to be covered by insurance, it's not going to be covered by the school district, it's going to cost $5,000. Okay. So the other parent may say one of a few things, may say, well, I don't agree with that therapy. It's not substantiated. It's experimental. It's, whatever. Or, yes, I think that would be great therapy to have, but we just can't afford it given all of the other needs we have. It's really, the approach on that is really not radically different than it would be with any other expenditure relating to children, where one parent says it's a necessity and the other says it's not as necessary or not an emergency. So what can you do? Well, obviously, if you're talking about a certain kind of therapy, the first question is, well, who is recommending? If it's just that someone read about it online or they heard it from a friend, it may not be the same thing as, for example, the child's a primary therapist or treating physician, or even someone from an evaluation context recommending it. So the first question is, what is the source for the recommendation, and the importance of it? And then so if there's a report or a letter or whatever, you want to take a look at that as number one, because obviously if it doesn't settle in mediation and that issue goes to a court for disposition because they couldn't work it out, that logically is what a court's going to want to see. They're not going to guess. They're going to, well, tell me why I should make anyone pay for this therapy. I need to hear from somebody with experience in this area, not just this is what a parent wants. So that's issue number one. And then the second thing is well, what's the most reasonable cost and availability? And can it be done perhaps on some kind of a trial basis to see if it's functional, to see if it works? Maybe you don't have to pay $5,000 up front. Maybe you can get a pay as you go, or maybe it's $500 up front, and just see if there's progress being made, not just in terms of the parents' view on it, but if the child has any autism-related professionals involved, either through private therapists or school therapists, or they go to a professional just to oversee this on a trial basis. Then you have somebody watching it and somebody giving their professional advice to the parents in a field that they may not be, experts in, to see if it's working, if they're getting value out of it, if there's a benefit. You get these cases sometimes where someone says, I want, X therapy. I'm not saying anything for or against this therapy. I'm just giving an example. They want dolphin therapy or horse therapy, or whatever it may be. And some people may say, well, I really want this because it's going to be very helpful. And another parent may say, I don't agree with it. There should be some therapy, but I don't agree with that therapy because it's not corroborated in the studies. I'm not saying it is or isn't, but that's just giving a hypothetical. So a mediator has to see, the mediator's job isn't to make a decision. The mediator's job is to see if there can be a joint commonality of approach on it, to maybe test something out, if it's worth testing out on a trial basis at a reasonable cost. Now, if you have a parent who wants the best for their child, but they just don't have the money to do this because they're making, they're making minimum wage and they've got 5 other children, let's say, or whatever it may be, and a million other bills to pay, it may be a situation where they can't afford it. That may actually be the reality of certain situations, but that's why you got to look at their financial resources and see what can make the most sense as kind of a balanced economic approach, as well as a logical approach to seeing if the therapy can pay dividends.
Yeah, I just wanted to add that everything is data driven. To look at what the progress is. And we're going to go back to what we talked about earlier with them saying, what are the particular traits that they have concerned with? And how is that particular program offering something different that may not be offered somewhere else? Like, for instance, if there is occupational therapist that is sensory integration trained, if there are hearing therapy components, like what is the breakdown and what are the components? And like Larry was discussing, on these trial bases, you can look and you can address these issues and have a plan for those issues, and it's tracked by data. So if you've been in a program and it is not working out and you're not seeing progress, then something needs to change. If there is progress, that just might make the difference of going to a different type of intervention or a different type of service of what's being offered, but it should be based back on the individual needs of that particular child that may not be addressed in another program.
And it's literally the same analysis in a way, or a similar analysis to what you would do in an intact family. The intact family has a child with autism, you're researching various therapies. It has to tie into your budget, though. It just has to, like anything else in this world. And that's a big concern, obviously. It's not the only concern, but it's a significant one. So the mediator has to look at it from all angles.
Okay, I have one additional question for you, but we've run out of time, so you have to give a brief answer. Okay. So, which is, what is a special needs trust and how are they used? Why is it used in the situation with autistic children?
Yes, I'll be very fast on this. Special needs trusts are really important. Let's say you have a child who does not have autism, it's very common in a divorce for people to reach an agreement. And part of their agreement is, for example, they're going to each carry a life insurance policy naming the child as the beneficiary and the other parent as trustee. Some mediators and attorneys even have it kind of like a boilerplate in their templates on their computer. The problem with doing that in a case with a child with autism, especially with severe autism, is if you leave money to the child as a beneficiary in life insurance, you could actually be hurting them, because you could be disqualifying them from benefits they might otherwise be entitled to through the government, such as Medicaid and DDD eligibility and things like that, because it's based in part upon need and SSI. So what you can do is you can leave, in those situations, it's logical to at least discuss the concept of making the beneficiary a special needs trust with the child as a beneficiary to the trust, so it doesn't disqualify the child. You don't run the same risk as you would if you just left it to the child in terms of disqualification. Now, special needs trusts, there are different types of special needs trusts. You want to make sure you have it right. And so what people agree to do in the course of mediation is they agree, especially if they kind of can cooperate with each other, communicate with each other, as part of their agreement, they will jointly select an attorney who concentrates in the area of estate planning and special needs trust to draft a special needs trust for the child or children with special needs as the beneficiary. And then the life insurance will become is essentially what funds the special needs trust. And also sometimes with support, sometimes people pay support to the special needs trust, particularly when children are over 18. So it's helpful, especially if you have cooperative parents, to consider the concept of them going for a consult with a special needs attorney to talk about, what the cost would be, the time involved, whether the attorney can represent both sides to make sure it's not a conflict based upon the situation, to have a special needs trust at least created. If it does create a conflict due to the nature of the parties and the positions they're taking, then obviously one attorney should not be representing both sides as far as that's concerned. But special needs trusts are very important to consider in any case involving a child, not just with autism, but any developmental disability, because the whole basis for it being established in the first place, in part, was to protect the child. Right. So without disqualification, hopefully.
Okay, so last thing is that you supplied to me some materials, and included in that materials was a case, what is it, Rooney v. Wall,
yes,
that you wrote the opinion.
I did.
I thought it was excellent explanation of both autism, the issues in parenting, etc. And I will be sending that out to everyone who attended this by the end of the day today. So with that, we really have run out of time. I want to thank you very much. It was really an excellent discussion. And yes.
Thank you for everyone who attended. And I want to give a special shout out to Carl Cangelosi, because this was the finale of the NJAPM's inaugural series on webinars. This was the last one for this season, correct, Carl?
The last one for the season. Next, we're going to start the next season in September, and it will run through May. We are going to have 9 CLE webinars, and there are some really interesting topics that will cover.
It was a very successful program, to my understanding. It was an honor. I think I was the first speaker on the first one, and then we're the last one on the last one. So we're closing it out.
It also happened to be your idea to have.
Well, it was, but you followed it through, and it was, I think, for NJAPM members, it's been great because you get these credits that are very, they're available. And I know a lot of the subject matter, the speakers I thought were all great and covered a lot. And so I'm looking forward to the series you put together for next season, for 2022.
Well, thank you, Joni. Thank you, Larry. And have a great week, everybody.
You too.
Right. Take care to everyone. Take care. Bye-bye.